Important message. Millions of people in the United States suffer from kidney disease and don't even know it until it's too late. If your kidneys fail, your life can change forever. Daily dialysis, waiting years for a transplant, or worse. Recognizing the early signs is the only way to protect yourself before permanent damage occurs. These signs can be subtle, but they are never random. Your body is always sending signals. The question is, are you listening? One of the most overlooked signs of kidney trouble is unexplained fatigue. People in the United States, especially those in their 40s and 50s, often blame their exhaustion on a busy lifestyle, stress, or poor sleep. But when your kidneys start to fail, your red blood cell production drops due to a lack of erythropoietin, a hormone made by the kidneys. With fewer red blood cells, less oxygen reaches your muscles and brain, leaving you tired all the time, even after a full night of sleep. A woman in Canada once said she felt like she was dragging a ton of bricks all day, every day, for no clear reason. Later, her doctors found out that her kidneys were only working at 30%. She said she thought she was just getting older. That false belief nearly cost her everything. Swelling in the hands, ankles, legs, or around the eyes can be another major red flag. This kind of puffiness, also called edema, is caused by excess fluid building up in the tissues. When the kidneys are healthy, they filter out excess sodium and water. When they're not, fluid leaks out and pools in the lower parts of your body. In the United Kingdom, many older adults have been misdiagnosed with joint or circulation problems, when the root cause was actually kidney failure. One man in his 60s shared how his feet were so swollen he couldn't fit into any of his shoes. His doctor first thought it was heart-related, but it turned out his kidneys had been in decline for years. In the United States, this mistake is incredibly common, especially when people don't advocate for proper kidney testing. If your socks are leaving deep marks around your ankles or your shoes feel tighter even though you haven't gained weight, your kidneys might already be crying for help. Foamy or bubbly urine is not something you should ignore. In Australia and the United States, primary care doctors often overlook this symptom during routine visits. But when urine starts to look frothy, it can be a sign of proteinuria, protein leaking into the urine. Normally, protein stays in your bloodstream, but when the kidneys are damaged, it seeps through the filters and ends up in the toilet. You may flush and move on without giving it a second thought. But if this happens frequently, you need to insist on a urine test. Protein in the urine is often one of the earliest warning signs of chronic kidney disease, and the longer it's ignored, the more irreversible the damage becomes. Changes in urination, especially frequency, color, and urgency, are deeply tied to kidney function. People in the United States often complain of needing to get up multiple times at night to urinate, thinking it's just part of aging or drinking too much water late in the evening. But when the kidneys start to lose filtering ability, you may urinate more often or much less. Sometimes the urine appears darker or there's visible blood. In the United Kingdom, doctors frequently discover blood in the urine during routine health checks, but too many people don't follow up after that first abnormal result. A woman in Australia said her urine had become rust-colored, but she waited 3 months before seeing a specialist. By then, her kidney function had dropped below 20%, and she was put on the transplant list. Do not guess. Do not wait. Urine is a mirror of kidney health. Lower back pain, especially on one side, can sometimes be dismissed as a muscle strain or part of aging, particularly among workers in the United States who have physically demanding jobs. But persistent pain located just under the rib cage near where the kidneys sit could be a sign of an infection, kidney stones, or cysts from conditions like polycystic kidney disease. A young man in Canada shared how he kept pushing through the pain with over-the-counter painkillers for months until he collapsed one day at work. His kidney had been bleeding from a ruptured cyst. Pain that comes and goes may not be muscular. When it's your kidney, you don't just feel sore. You feel deep, aching pressure that sometimes radiates to the front of your abdomen. If you've experienced this kind of pain, Your kidneys could be under serious threat. Metallic taste in the mouth and ammonia breath are lesser-known signs, but incredibly common among those with declining kidney function. When toxins build up in the blood, a condition known as uremia, they begin to affect your entire system, including your sense of taste. Food might taste bitter, or you might lose interest in eating altogether. A patient in the United States once said she started avoiding her favorite meals because everything tasted like pennies. Her weight plummeted, and she couldn't understand why, even though she wasn't dieting. In Canada, this symptom is often mistaken for dental issues, but cleaning your teeth won't fix a chemical imbalance in the bloodstream. If your breath smells like ammonia or your tongue feels coated in bitterness, your kidneys are already struggling to clean your blood effectively. Nausea and vomiting that come out of nowhere, not tied to food poisoning or the stomach flu, may be your body's desperate attempt to rid itself of toxins. Kidneys that can no longer properly filter waste cause a buildup of urea and other harmful substances. These compounds irritate the gastrointestinal tract, leading to feelings of constant nausea. In the United Kingdom and Australia, ERs regularly see patients who show up for unexplained vomiting, thinking it's a bug, only to find their kidney function has sharply declined. One man described how he'd wake up feeling fine but become sick every morning by noon, sometimes vomiting bile. He tried switching diets, avoiding dairy, and taking probiotics, but none of it worked because the problem wasn't in his gut. It was in his kidneys. Shortness of breath, especially when not doing strenuous activity, can be a sneaky but deadly sign. Many people in the United States assume that if they're breathless, it must be their heart or lungs. But kidney disease can cause fluid to build up in the lungs or lead to anemia, both of which rob your body of oxygen. A woman in her 50s in the United States started noticing she had to catch her breath even when just walking from her car to the front door. Her heart checked out fine, and so did her lungs, but her hemoglobin was critically low, and her kidney function had been quietly deteriorating for years. Doctors later said if she hadn't come in when she did, she could have ended up in respiratory distress. If you are gasping for air doing ordinary things, folding laundry, walking across the room, your kidneys may be failing without any pain or visible symptoms. Cold intolerance and feeling chilly all the time can be an early warning sign. Many doctors overlook, especially in patients without thyroid issues. Anemia caused by kidney failure reduces blood flow and oxygen to tissues, making it hard to maintain body heat. People in Canada and the northern United States may blame cold hands and feet on the weather, but if you're always bundled up while others are fine, or if your nails turn pale or bluish, this could be a symptom of decreased kidney function. One man from Minnesota said he slept in socks and 3 blankets year-round and still felt like he was freezing. Later, he found out his hemoglobin had dropped drastically, and his kidneys were the root cause. This type of symptom is often brushed off as minor, but it's your body waving a red flag. Persistent itching, especially when it's not linked to any rash or allergy, can be a sign your kidneys aren't filtering waste products properly. When toxins like urea accumulate in the blood, they irritate the skin and nerves, leading to a maddening itch that won't go away with creams or antihistamines. A woman in Australia described how she scratched her legs so much at night that she bled. She was prescribed moisturizers, allergy meds, even antidepressants, but the itching never stopped. Months later, her labs showed advanced kidney damage. In the United Kingdom, dermatologists are trained to look out for systemic causes of itching, but in the United States, it's often treated as a skin problem until a blood test reveals the truth. If you're itching deep under the skin and nothing brings relief, your kidneys may be overloaded with waste they can no longer remove. Another powerful and alarming sign that your kidney health may be in danger is high blood pressure that is difficult to control. In the United States, hypertension is one of the most common chronic conditions, and it is both a cause and a consequence of kidney damage. When your kidneys are injured, they lose the ability to regulate blood pressure by balancing sodium and fluid in the body. This creates a dangerous loop. High blood pressure damages the kidneys, and damaged kidneys make the blood pressure worse. A man in the United Kingdom who had never had high blood pressure before suddenly spiked to 170, 110, and his doctors kept adjusting his meds without success. Eventually, blood work revealed stage 3 kidney disease, and his blood pressure didn't stabilize until treatment focused on kidney support. If your readings are creeping up even with medication, or if your doctor keeps increasing your dosage, this may be a warning sign that your kidneys are under attack and cannot manage your vascular health anymore. Muscle cramps, especially at night or in the early morning, can indicate an imbalance of key minerals such as calcium, potassium, and phosphorus, all of which are regulated by the kidneys. In people from Canada and Australia, cramps are often brushed off as dehydration or poor circulation, but the truth is much more serious when the kidneys aren't working right. These cramps can be sudden, severe, and frequent, sometimes waking people up from sleep. One woman shared how she began having painful spasms in her calves and feet every single night. Doctors told her it might be from exercise or low magnesium. After months of no answers, her blood panel showed advanced kidney decline with abnormal electrolytes. Muscle cramps are not just annoying, they are signals of something bigger. Your body's internal chemistry is shifting because your kidneys can no longer balance the minerals needed for proper nerve and muscle function. Another signal that's often overlooked is difficulty concentrating or mental fog. Many patients in the United States, especially older adults, describe it as feeling cloudy or like their brain is wrapped in cotton. When the kidneys fail, to remove waste from the bloodstream, those toxins travel to the brain and disrupt normal cognitive functions. People may forget things more often, have trouble following conversations, or struggle to finish routine tasks. One patient in Australia said he started forgetting where he placed items, how to use certain tools he'd worked with for years, and even forgot his home Wi-Fi password multiple times in a week. His family thought it was early dementia, but after testing, doctors discovered it was due to uremic encephalopathy, cognitive dysfunction caused by kidney failure. If your thinking feels slower or your memory is slipping for no clear reason, don't ignore it. Your brain needs clean blood, and that job falls squarely on the kidneys. Loss of appetite and unintended weight loss can creep in silently and seem harmless at first. In the United States, some people even feel relieved when they drop weight without trying, but if the cause is kidney dysfunction, it's anything but good news. Waste buildup in the blood and electrolyte imbalances lead to nausea, altered taste, and a disinterest in eating. Eventually, this causes severe nutritional deficiencies, muscle wasting, and weakness. A man in Canada dropped 25 pounds in 4 months despite eating normally, and he noticed that even his favorite meals no longer appealed to him. He described food as tasting bland or even metallic. Doctors later discovered advanced renal failure. The body loses its desire to eat when it's overloaded with toxins. If you're losing weight without trying and you're also tired, nauseous, or feel off in general, demand lab work, especially kidney function tests like creatinine and eGFR. Persistent headaches, especially when combined with other symptoms, like fatigue and nausea, can also be tied to kidney health. This connection is usually missed in both the United Kingdom and the United States, where people are often told it's dehydration, tension, or stress. But when kidneys are compromised, they fail to properly balance fluid and electrolytes, which leads to increased intracranial pressure or severe shifts in blood pressure, both of which can trigger intense, recurring headaches. One woman in Australia said she had migraines 3 to 4 times a week, and nothing helped. Not hydration, not prescription meds, not lifestyle changes. It wasn't until she had routine labs during an annual checkup that her doctors discovered her creatinine levels were dangerously high. If you're getting more headaches than usual and nothing is helping, it's time to ask your doctor to look at your kidney function before dismissing it as just another migraine. Dark circles under the eyes and puffiness in the face, especially first thing in the morning, can also signal trouble with your kidneys. This is often the result of protein leaking into the urine and causing fluid retention. People in the United States frequently attribute this to poor sleep or allergies, and in Canada it's often blamed on aging. But when these signs appear, alongside fatigue, muscle cramps, or changes in urine, they must not be ignored. A woman shared how she started seeing deep shadows under her eyes despite getting enough sleep. Makeup didn't help, and she thought she just looked tired. Weeks later, she was diagnosed with stage 4 kidney disease. That darkness wasn't cosmetic. It was a visual cue that her kidneys were no longer doing their job. Another clue that often goes unnoticed is bad breath that smells like fish or urine, which is very specific to uremia. This isn't standard halitosis from poor oral hygiene. It's a deep chemical smell caused by nitrogenous waste building up in the blood and excreted through the lungs and saliva. This is common among patients in advanced stages of chronic kidney disease, especially in the United States where dialysis is delayed until symptoms become severe. A man said his wife noticed his breath had become so unpleasant that it lingered in the room. Dentists found nothing wrong with his gums or teeth. Eventually, his urologist found dangerously high levels of urea in his system. If your breath has changed and doesn't improve with brushing, flossing, or diet changes, this may be your body's final warning. Rashes, especially ones that don't respond to creams or keep coming back, can also signal that waste products are seeping into the skin. This is often a late symptom, but not always. These rashes are usually itchy, red, and patchy, sometimes resembling eczema or psoriasis, but no topical treatments bring relief because the cause is internal. In Australia and the United Kingdom, dermatologists sometimes miss this link unless they are working closely with a nephrologist. One patient in the United States went through 4 dermatologists and dozens of ointments before her blood test revealed the real issue. Her kidneys were failing. The toxins that should have been filtered out were showing up in her skin. If your rash is chronic, spreading, or not responding to treatment, the issue may not be your skin but your kidneys. Another underappreciated sign is frequent hiccups or muscle twitching. This might sound unrelated, but in people with advanced kidney disease, the accumulation of waste products and changes in electrolytes, such as calcium and magnesium, can overstimulate nerves and muscles. This leads to involuntary spasms, twitching, or even hiccups that won't stop. These symptoms are rarely brought up in primary care clinics in the United States, and most patients don't even report them until they become unbearable. One man in Canada had hiccups every night that lasted over an hour. He was told it was acid reflux, but no medication worked. A nephrologist later confirmed he had reached stage 4 kidney disease, and his electrolyte balance was completely disrupted. If something as minor as hiccups becomes persistent, it's not minor anymore. It's another signal that your kidneys may be losing control of the body's most critical balances. Mood changes such as depression, irritability, or anxiety can also be deeply connected to kidney function. When the body is full of toxins and inflammation, it affects the brain's chemistry, and many patients feel emotionally unstable without any psychological history. A woman in the United Kingdom said she started snapping at her children, crying for no reason, and feeling hopeless every morning. She was diagnosed with clinical depression and put on antidepressants, but nothing worked. Months later, a renal specialist discovered her kidney function had dropped to 28%. Once she started dialysis, her mood stabilized. Her emotional instability had a physical cause. If you're not feeling like yourself and other signs are present, it might not be just stress. It might be your kidneys. Your body never lies. The signs are all around us, but the healthcare systems in places like the United States and United Kingdom are not built for early intervention unless you push for it. People in Australia and Canada face similar struggles, with long waits to see specialists and a tendency to treat symptoms in isolation. You have to connect the dots and advocate for complete lab panels, especially creatinine, eGFR, BUN, and urinalysis. Every warning sign is your opportunity to prevent permanent damage. The earlier you listen, the more likely you can stop it before dialysis or transplant becomes your only option.